Family practice. For many doctors, it's just not much fun anymore. In the Fraser Health Authority, Dr. Davidicus Wong has a solo practice in Burnaby. The long hours mean less time with his growing family. At Dr. Michael Newton's shared practice in Abbotsford, also in Fraser Health, the time crunch means skipping lunch to squeeze in important appointments. Not the healthiest choice.
I just came to a point where I felt that something has to change. I couldn't see myself continuing to do this for the next 25 years.
And if we lose our passion, if we get really exhausted with the work that we're doing every day, then we're going to get depressed and stressed and give up.
To remedy the problems, 16 pilot sites within the Fraser Health Authority are in various stages of practice redesign. Dr. Wong and Dr. Newton are two physicians who are revitalizing their primary care practices. At Dr. Wong's office, reorganizing the work of the MOAs to be more involved in patient care is an important initiative. His wife and MOA, Sue Ann, manages the office. She and fellow MOA, Jessica Macht, both enjoy their new responsibilities.
I find it easy to chat with the patients, like some of our patients that are on blood thinners that we talk to sometimes every week, sometimes every other week. I call them and if I'm not busy, I talk to them for 5 minutes and say, how's it going? Especially some of the people that live on their own and don't have anybody to talk to on a daily basis. It's kind of easy.
Dr. Newton's clinic has also developed a team approach using the support of MOAs and nurse practitioners. Relatively new in BC, they're educated, trained, and certified to deal with a great range of health issues.
I see everything from birth to death. I do a lot of chronic disease management because I have a lot of time to spend with the diabetics, congestive heart failure people with asthma. So the advantage is we can take care of some of those things that are not very complex. And we can offload that for the physician so that the physician then can see the more complex or difficult patients.
Patients are far better served now under the new system than what they were in the past. That's certainly been the feedback I've had from the patients, and it's been my own experience.
Yeah, I get all information that I need to help myself and to come over the problem. I'm very happy.
And then when we started actually getting feedback, producing graphs and seeing how well we are at controlling the A1Cs and measuring blood pressure, getting the lipid ratio down to the goal level, once you start seeing those changes, you realize that even though if you thought you were doing a good job, you could be doing a great job. And that has tremendous benefits for your patients in the long term.
And as chair of family practice at Burnaby General Hospital, Dr. Wong is spreading the word. He encourages other doctors to consider making changes in their practices. Changes such as improving IT solutions, including the use of electronic medical records. Implementing the advanced access model, which makes scheduling simpler and less time-consuming. And trying new approaches to self-management for patients with chronic disease.
I feel that these changes have been a step, definitely a big step in the right direction. And obviously every system is always an evolution, and we're constantly looking at ways to improve on what we're doing.
If we're successful in continuing to manage our patients in the community and striving for excellence, with an appropriate lifestyle, is going to make a big difference. We'll save a lot of money and a lot of lives.
On a personal note, for both doctors, family practice redesign has relieved some of their own stress and time pressures. For Dr. Wong, it allows more time for his family.
So what time do I have to be home?
I have to pick up the kids at 6.
And research for his weekly newspaper column about healthy lifestyle. For Dr. Newton, it means planning and taking an extended family vacation, his first in 20 years.
For many years, I think I neglected the quality of life issue in favor of providing quality of care, and I've come to realize that without looking after your quality of life, you eventually lose effectiveness as a practitioner as well.
I think the greatest value for all these changes is to preserve family practice. Because what family doctors do is quite unique. We need to preserve that, and we need to support our family doctors. And as family doctors, we have to take responsibility to do the best with what we have. And I think these changes in practice support can enable that for family doctors that are willing to make the changes.